Good morning, James Clem. How you doing, my brother? You doing all right?
I'm doing
Yeah.
well, but should I share a little story?
Yeah,
I
of
got a
course.
I got a call from my alarm service at the office late last night, and they're saying your alarm's going off. Do you want the police? And I'm going, wait a minute, it's a stable alarm. It made it through all the winds with the fires, and I said we better check it out. So I put Jordan in the truck. We went over there. They wanted to know what I looked like, so the police showed up just right after me, and I'm 5 minutes away from the office. But it was really interesting to watch them take care of the situation, and I learned a lot from that.
What
But
was it?
everything's cool.
What made your alarm
It
go off?
probably was a bad sensor,
Oh,
but but it got my adrenaline going, so I had a hard time getting back to sleep. So this is an extenuation of just my night. But
oh
I'm
man.
feeling I'm feeling good because I'm looking forward to our guest today, and I'm also looking forward to talking with you.
Sure you are. You're probably getting tired of me, man. We've done so
I'm
many of
not.
this.
I'm not. In fact, the more we do this, the more I admire you.
I don't believe that. You have a hard time lying, James Clem. So that's okay.
Todd, okay, take that compliment, touch your chest, put
Yes,
it
sir.
into your heart, and go with it.
I'm going with it. Thank you, my friend. You're always an
Okay.
inspiration. Yeah, I've had a regular morning. I woke up a little bit, on the downside. We had such a positive day yesterday with our
Yeah.
guests, and just it was almost a letdown when I woke up this morning, thinking we gotta. I got to get back to work because I don't know if you know, Texas has kind of changed their opening date, so I got to regroup all of my thinking and replan everything and get things going. So we're going to change up our schedule just a little bit, but we'll get it going. But
And the open date's on Monday, right?
yeah, well, as far as
As far as you
as
know.
far as as far as we know, because the information is changing by the hour. We can open on Friday, which I'm personally going to open up probably on Tuesday of next week. Kind of let things shake out a little bit and do
Sure,
what
sure.
what
Yeah.
I'm calling a soft start. We're gonna maybe not try to go at it full speed, but we've got a awesome guest today, and
Yes, we do.
one of the epic ladies. And before we introduce her, you've got to do your deep thoughts because this is a good one.
My deep thoughts, and Todd, do you know who Sir Edmund Hillary is?
Sir Edmund Hillary. I am not too sure who that is.
Well, as a kid, I loved mountain climbing, and I never climbed Mount Everest, but he was the first
Oh,
person to climb Mount Everest. And it's a really short quote, but it's profound. And he says, "It's not the mountain we conquer, but it's ourselves." And I've had to deal with that as I vacillated through my various emotions with this downtime. Because, as you think, that will control your filters and how you process the day. And thinking will control the emotional chemistry of the brain. And I'm really looking forward to talking with Lynn because she's very strategic. And I'm going to be a better person after we talk to her today because her advice on how she's dealing with her practice is going to be very poignant for us. So I'm looking forward to talking with her. You want to bring her on?
yeah, no, she's on right now. Lynne Thomas, Dr.
Dr.
Lynn.
Lynn Thomas, San Diego. I'm
Hey
feeling the
guys,
weather.
see you, Diego. Yeah, it's great to be here. Thank you for having me this morning. It's
And
awesome.
it's an honor to have you. And you're
Get out
part
of
of
my
the,
pajamas today, a little bit earlier.
yeah.
But that's great, Todd, that you're going to be heading back to work soon. I'd love to get that message. Waiting for that, right, James?
Yeah. Do you know anything about your county yet? Because we got a notice last night that we'll probably be shut down till the end of May now, which, of course, they can lift that any time.
Yeah,
But that's the Bay Area,
yeah,
which
I heard
is
about
going to.
that. Yeah, so we have not officially received a notification yet for San Diego, but it'll probably come down the pipeline soon. And honestly, I'm really hoping it's not going to be the end of May. That is way too long. I miss my team. I miss my patients, and I'm so ready to get back. I just it's just yeah, it's a little frustrating, but got to be patient and try to take all of that energy that I have, cooped up here and bring it to the positive and think about how we're going to reinvent ourselves, because this is kind of like a reset button with all of this COVID things for our practices when you really think about it.
It really is. Yeah.
Yeah, it's nice. If there was something that you were unhappy with before we went through this quarantine, now's the time to think about like what it was and how you're going to change it. And, you can. There's no doubt about that. Improper, work-life balance, whatever it was, do it.
So how's your team handling this, Lynn? How are you communicating and what are you guys doing?
So we talk with our team once a week, if not more than that. It depends if I have emergencies, and they're doing really well, I have to say. We've got them tasked to contact our patients and make sure that everything is in order with them, because we have patients that are going through ortho, we have patients in prototypes, people who are waiting to get implants, need to make sure that they're okay, that they understand how, this whole process is going to work. So kind of like how Mona was saying yesterday, just being as transparent as possible, want them to be as comfortable as ever, when they come back in. I mean, as dentists, if we're not the infection control specialist, who is?
Totally.
Exactly. What I'm encouraging people to say is you're not going to be in a cleaner room in your entire day than where you're at right now.
For sure. Yeah, absolutely. I mean, this is stuff that we're used to handling. So, we just have to be able to convey that to our patients and make them feel as comfortable as possible. We got this. This is no
Todd,
issue.
Are you going to share with Lynn what you're seeing on the screen right now?
Oh my gosh, we're already at 300 hearts. 304.
There's a continuous heart, and it's actually coming up through me, and I'm pushing it over to you.
Yeah, we're trying to get some over to you. I got a great little quote from Dennis and Debbie Hobson. Dr. Thomas, you are the best! Exclamation mark. And then
isn't that nice?
Yeah, and then
I miss those guys.
And then Enzo Dana Bello. Yay, Dr. Thomas. You got a lot of fans out there, and then your epic ladies are definitely responding as well. So thank you guys for all of that. And then
how about those epic ladies? They're so awesome. I mean, I feel like kind of the big sister for them because I'm a little bit older than they are, but I'm so impressed with everything they do. I think about the caliber of dentistry that they do, and it's really impressive to me. And I think like, gosh, when I was that far out of school, there is no way I was doing the level of care that they're doing. So a shout out to them. And it's not just the epic ladies, although I know them, I'm most familiar with them, but like Devel Patel and things that he puts out on Facebook with his prep, it's amazing. So,
well, I'm excited.
A lot of that has to do with you guys too. You have so much information available to us online that's readily available. It allows us to be awesome clinicians. So thank you for the platforms you provide for us.
Good. Well, thank you, Lynn. And I know that I feel that the energy, there's a momentum that the Epic ladies have that will positively affect what we do with CAD/CAM. I think you're going to raise it to a bar that we haven't seen yet. And I'm really excited about that. Todd and I get to hang out with you guys next November, and we feel really privileged with that.
Oh, that's awesome. I'm actually speaking then.
Oh, nice.
I can't wait to learn from you. I've been watching your cases online, and you're just excelling. And it's just a joy to see that. I also see that you're educating other dentists out of your office now. You want to tell us a little bit about that?
Yeah, so, for us, everybody learns differently, and I think that to have the hands-on application, it's really nice. So we collaborated a little bit with Henry Schein, and they've brought in some dentists, that are interested in digital dentistry, whether they already have, it incorporated in their practice or not, and just kind of try to expose them to the unlimited possibilities and opportunities that you have when you do digital dentistry. It's the greatest thing ever. Jürgen and I have had digital technology in our office since 2004, and that's when it was a red cam, and one of the things that really enticed us to go in that direction was just having control over the product you produce. And boy, it's so much fun. I just can't imagine doing dentistry any other way, and it keeps me young.
And we need that right now. As you see coming back, and Todd, why don't you ask your question about the trickle or fire hose?
Yeah, no, I've asked everybody. In your practice demographics, do you see when it comes back as a fire hose of patients, or do you think it's going to be drip, drip, drip? How do you see that happening?
Gosh, it's a little bit unpredictable and I'm basing that only because of the calls that we've had from, our patients who are really anxious to get back. And hopefully they trust us enough to know that we're going to be doing everything that we need to do to keep them safe and keep our, team safe. That's for sure. And so, I think you just kind of have to take it one day at a time. And I know that a couple of things that we're going to change is probably going to be, seeing changing our scheduling, where we might be seeing patients that are a little bit older on certain days, or maybe have some of the ortho cases where we're not going to be generating a lot of aerosols on those days, have some of the exams and stuff like that on those days. We kind of got to feel how it goes and how all of the information from the CDC kind of pans out. Every change as far as learning more about like how many people are infected already, who has antibodies, who doesn't. My feeling is I think that there's probably more people that have the antibodies than they think, So I think that's going to influence definitely the way that we do the scheduling. It's just, you got to take it one day, 1 week at a time. But the most important thing is the mindset that we set for, the team and for our patients, and letting them feel safe and secure in their environment.
Safe really and secure. That's go ahead, Todd, but safe and secure.
That's
the emotional thing.
Absolutely. What I was thinking of is, as you were saying all that, is that, the three of us being dentists and very detail oriented, and we want everything to be just right in the operatory and the patient experience. I think we may be seeing, we're not seeing the big picture. The big picture is just like what we said earlier. We already do everything. We're already very well mindset on, making sure things are clean and we're not breathing in junk. And, so the problem for me is, and since we can start earlier than Texas, what I'm a little concerned about is what is the CDC going to be saying in 2 days, in 3 days, in 4 days? So I'm kind of worried that, hey, when I start on Monday, am I doing what the CDC says or my local state? And then, by the time you guys get started, it's going to change even more so. So with a long-winded answer is we're already doing what we should be doing, and we should encourage our patients. We've been doing this from day one. So anyway, what do you feel about that?
Yeah, Jürgen had a great idea to put the videos on our website about like wearing gloves in public places. I don't know how you guys kind of feel about that, but I see some people that are wearing them and then they're, looking at their phones and touching everything. And I'm just like, trying to educate people like how that all is supposed to work, right? Because we're the infection control specialists,
I laughed.
It's just a very interesting time. But, I have to share this with you guys really quick.
Please.
I started, so dentistry is the only thing I've ever done in my life. I started off as a dental assistant when I was 16 years old. And that was in 1984, right? So in 1984, I worked for an endodontist, and those guys did not use gloves, did not use masks, they did not use protective eyewear, right? And then what hit? Remember this?
That's right.
I don't know if you guys can see that really well.
Yeah.
I feel like it's just like a flashback of going through. I mean, this is going to change the way we do things, and it changed things for our patients. I think predominantly they're going to be so much more aware of, the things that they're going to be looking for things. They're going to be aware of what they need to do to contribute to keep themselves in a healthy state and in a safe state. So it's going to be interesting.
Do you see these hands? I started practicing in '84. These hands did not have gloves probably for about a year and a half. I'd placed them on for just surgical procedures, and I remember having to talk to my patients of why I was wearing gloves. And believe it or not, I had a few people get offended because I was wearing gloves and because I was thinking they were contagious. But has that world ever changed?
It's a mindset, you know, it's a mindset that you have to shift, and here's a better word, defining moment, right?
Defining moment
of what changes the course of things. And wow, I never anticipated something like this from the COVID-19, being quarantined for, what are we on, 6 weeks or something like that?
Yeah.
That's unbelievable when you really think about it. Nobody will ever forget this, you know?
No.
So,
well, I don't want to go ahead, Todd.
What do you think the best thing that's going to come out of all this will be?
Yeah, that's a good question.
Here's what I hope. I hope that we really put more emphasis on the relationships with our patients, you know, instead of like volume and, moving here, moving there. I hope that we're able to re-emphasize the value of that relationship with patients, because that's how you develop trust and all of those kind of things, you know, and in some of those environments, where someone goes in, they see this guy preps or this guy diagnosed, this one, preps, this one delivers. I don't know that people will want that anymore. You know, it's going to be a little bit different. They want to feel secure in their environment and know that all the, everything that you're doing from point A to point B is getting taken care of. So that would be my hope.
Okay. Yeah.
I gotta stop here. I gotta stop. That was great. Whatever you just said was super great. We're at 2,500 hearts. I mean, 2,500. Clem is like smeared.
Awesome.
I'm never going to feel this love because on the screen it always comes up through me. I actually wore pink today, so
yes,
I would have more in common with the hearts because I am color coordinated, and these hearts, the surrounding of the hearts, Lynn, are close to the color of your outfit, which is stunning. You're looking great today. It's all.
Janice Hurley, she hooked me up. She told me this is what you need to do.
I love
it. That. Yeah, I don't know if you guys know her, but she's amazing. Really good.
Yeah.
So so here I wanted to share a couple other things, So we always in dentistry are talking about analog world, digital world, right? And we're all digital people, the three of us. But here's my analog response to the mask situation, right? I sewed these and made these. They've got N95 filters in them. Woo-hoo. And then with the help of Frankie Acosta, you guys probably know Frankie, right?
Yes.
He's watching. Frankie's watching.
Love Frankie.
Shout out to Frankie.
And so he printed this for us. Got this file from a dentist up in Oregon, Jeff Johnson. Yeah. And we sent it over to Frankie because we don't have a printer yet. Jurgen's been looking at August's website and all of the information he has on there. So he's got something going with August now. And but at any rate, so we took this. I hooked it up with the elastics, made that filter, and so this little thing on here. So we're gonna equip our team with these because I think it's a little more comfortable than wearing the material N95. Have you guys experimented with that at all? What's your feeling on it?
I don't know. Like I said earlier, everything's so up in the air. Is that going to be necessary, or we're going to need a whole helmet? I'm ready to wear my motorcycle helmet. I'm ready. I just put a lead of oxygen through it. I'll do that.
That's great. Yeah.
But just the fact that digital dentistry is kind of leading the way in printing and making contraptions, it makes me know that we're going to make something right. So all of these new inventions that are coming out, one of them is going to be the right one for somebody. So I don't know what the right answer is at this point, but what do you think, James?
Well, I know I was listening to a interview at the Hoover Institute where they were interviewing the physician at Stanford who had done the initial antibody testing, and it was really interesting with his statistics because it appears as though the fatality on this is going to be close to the common flu. And what they're finding is that the majority of people who have antibodies are not having symptoms at all. We don't know how long those antibodies are going to last, but he also made a comment which caught my attention. He says there's no way to contain this.
Yeah.
So I really think the future for us is going to be screening, because we're working on a mouth. If someone's contagious, there's no way to contain that practically within our profession, in my opinion. That's kind of where I'm going right now. So I think as we see more testing coming out, and they're doing these tests across the country right now, it is a bad thing when you get the symptoms. But a lot of people, I actually think I've already had it, because I was traveling. I came home and had a bad headache for 5 days, which I never get, and I was sweating at night, and my wife had the same thing. And then we actually are into energetic medicine as well, and we actually tested positive for the coronavirus. And I've the energetic readings that we get from those systems, whenever I get a blood test, it's spot on. So we'll see. I'm not saying that's where it is right now, but we all want to go with the good scientific method on this. But I think more people have had it than we know.
My thoughts on it is that I don't know if it really matters so much. It does matter, but what really matters right now in all this time of fear and confusion and social media, fake news, whatever, it's the perception that we give our patients when they come into that operatory in our waiting rooms, and that's our responsibility. And I already know the three of us are going to do a good job. And so, Lynne, what could you tell some of the people that are watching right now that maybe what you're going to do for the workflow of the patient coming in? Are they going to wait in the parking lot? Are you going to walk somebody in? What do you think that's going to look like?
Yeah, so what we're doing is, we're text messaging all of our patients ahead of time to kind of explain to them the whole process. So we're not going to have a waiting room anymore. What we're going to hope to do, what's really nice, is that our operatories actually have doors.
Oh,
so
yeah.
We have like a practice that was built with, in the 80s, and so we have doors, and we plan to put air filters in there, but when we trigger, when we're ready for our patient, we'll go ahead and text message and meet them outside of our office, do their temperature. They should have the form already with them. So again, before the night, the day before, we'll actually email them a survey that will have scan it and send it back to us, or they'll bring it with them. And of course, it's going to address, hey, look, if you're not feeling good, if you have a fever or any of those things, cancel the appointment. I mean, this is what we have to do. And people are going to definitely have to be much more understanding on all different levels. If I get a fever, I can't work, and so, that's going to be how we're going to regulate them before they come in the office. And when they come in the office, they're going to go right into the operatory. And then whatever assistant or hygienist is with them, they will stay with that patient the entire procedure.
Yeah.
And then we'll have, people who will be running, and equipping us with what we need so that we can cut down on somebody going in and out, in and out, in and out. I also think that one of the things that I'd like to do is almost put like a huge, barbershop apron on our patients, so that when we are generating the aerosols, carefully contain that up, put it into,
that is brilliant.
That's one of the best I've heard yet.
That is great.
Yeah.
Well, since there's nothing like that, maybe you should start sewing right now. You got all those masks going. Maybe you can start sewing me a drape.
Yeah, exactly.
Yeah.
You can get the material,
Maybe we could just use a big black, hefty bag or something,
Yeah.
But it's true.
That's a great idea.
That's brilliant, because we do that when I do implants now. We cover the patient with a disposable drape, and it's easier to manage. And
yes,
I think that's great.
Disposable drapes. I didn't even know that, but yeah, I think that's going to be the way to go for sure. So I think that our clinical environment is going to be like we're doing surgery on everybody.
Yeah.
What do you think?
There's a part of me on this that I think is actually going to be good for our profession and maybe slowing down a little bit. I've been doing that for years. I see one patient at a time. I don't usually do double rooms. It's just the style I like, because I like the flow, and I like a little time between patients. and we're going to need that. And
Absolutely.
in the long run, that
Yeah.
may be a little bit of stress financially if your practice hasn't operated that way. But I can tell you, it can work that way if you work it right. And
Absolutely.
I was talking with my team, and they felt that we're probably really not going to change too much as far as our clinical flow. But I think the air filter thing. What air filters are you getting?
That's Jurgen's job. He's got that
Yeah.
under control. He's been researching it. Poor Jurgen, he actually snapped his patellar tendon, and he's not only quarantined, but he's been isolated to the couch or the bed. So,
oh no!
I have to ask him to do something, so I have him researching all that, and we got.
You're a good leader. You're
so
a good
much
leader.
Information out there, I just can't keep up with it, really, And
Lynn,
so we kind of divide things up that way.
Lynn, not everybody knows the fact that you're married to a dentist.
Okay.
You want to tell us about that a little bit?
Yeah, so my husband is a German-trained dentist, and I met him when I was in the Air Force when I was stationed at Ramstein in Germany.
Okay.
And so, we've now been together for 20
2002.
years.
You were married in 2002. I love.
Oh, did he text that? I know, it's terrible, right? Like, I should know all those dates.
I love it.
Better with the dates than I am. It's so horrible. But so we decided to practice together. We initially had 2 separate practices. So, I had kind of my thing going on in one location, and him. We kind of flip-flop a couple of days a week. And then it just got to be too stressful for our, for our team predominantly, because we're both really into continuing education. It's kind of, what we like to do. And when you go together, we have to close down both practices. It just didn't work for us. And so we actually merged the practices back in 2015. It was the best thing we ever did.
Oh, good.
Because now he can go on continuing education, and I'm still there to take care of the family of patients, and the team can still work. And likewise, when I go, he's there, and sometimes we go together and we just close the office down to, so that everybody can have a vacation. So it's definitely been much more beneficial, I think, and healthier for us and our team, when we consolidated, for sure.
Lynn, I remember the first time I met you in Jurgen. It was at a study group. It must have been around 2005, and I still remember that. Both you folks really impressed me. Distinguished people, professional, and you definitely know your dentistry, and I really admire you for that. That's cool.
I'm sorry, we got a challenge. We got a challenge from Mona Patel. She says, Lynn, you got to do the stair shuffle.
Oh, there is no way. I am right with James on that one. There is no way I can do that. And I value my front teeth too much. I do not want to fall on them.
That is true.
Lynn, your excuse right now is your excuse is your husband already has a broken bone right now. You certainly couldn't risk your business right now.
But we love the love.
Lots of hearts, Mona and Shibby. You guys are amazing. But that's
we're gonna hit. I'm not even joking. We're gonna hit 4,000 here in a minute. You got great friends. Now,
I didn't even know that was the thing with the hearts until yesterday. That was really funny. So
yeah, it's crazy. Awesome. Yeah, so tell us more about the Epic Ladies and what you guys are doing. What's the reason for this? And you guys are having a meeting, I think, here in November that we're going to see you at.
Yeah, so we're having a meeting in November up in Napa Valley. We're going to be in your part of town, James. And we're looking forward to it. It's going to be great. Sarah Jockin's going to be speaking about implants. And Chris and I are going to be handling photography and macro and micro aesthetics of our smile design cases. And it's going to be great. And of course, Sarah did a wonderful job last year when she had it in Florida, where, there was yoga, will of course be a little bit of wine tasting, and so it's going to be a great event, and I look forward to it. It's really fun and comfortable to be around these ladies. We share and exchange ideas, and it's really awesome. Really appreciate the fact that Dental Splice Corona got us all together, and listening to that first meeting that we had. Chris Adlin spoke, and Mona Patel. and Sarah Jockin, and of course a couple other people. But I mean, they were amazing and so insightful, and it just really charges you up. I don't know if you guys feel that way when you go to continuing education, but you come back and you're like renewed, and you're ready to go. And yeah.
You know what I love about the Epic ladies? I love all of them. They're so great. I've just gotten to know all of them. They're super people. But you guys you girls are a movement, and you're bringing passion back to digital dentistry. And that is one of the main reasons why I got into digital dentistry in CEREC years ago, was because there was a brotherhood that was nothing else, and it's sustainable, and there's history involved, and we've kind of let that fade over the last 7 or 8 years, and you guys are an inspiration. So I'm just really, really excited to be a part of this. I feel like the lady right now.
We don't want to forget about the brothers. We love the brothers too.
Nah, we need more estrogen in our world, right, James? More pink, more pink. We're gonna hit 5,000 hearts if Karen keeps going.
Yeah.
Yeah, and so that just so we don't forget, Mona just said that the meeting is going to be November 5th through the 7th. So we need to promote that.
Yeah, it was supposed to be in a couple of weeks, but we had to change it, of course, due to all this, And so November 5th through the 7th, Napa Valley. It's going to be a great time. Gotta get your lead tank full. Your dental lead tank and your female lead tank.
Love it.
Come on. It's going to be great.
That's awesome.
Lynn, one thing that I've enjoyed interviewing many of your colleagues in our Facebook Live is that, and I mentioned it yesterday to Mona, it's helped me find my first love feelings about dentistry again. Mm-hmm. I mean, I love the academic side of dentistry. I love the clinical side. But to get in there, I remember the freshness I had when I first started practice, or where you had the dreams in front of you. And you folks have brought that out. And I have to thank you folks. It's actually been very enthused. It's been therapy for me. And
That's awesome.
In fact, I went to my office yesterday after our interviews, and I was scrubbing the floors, and I was looking at everything, and Jordan was going, what are you up to here? And I was thinking, let's get this palace ready for our clients again. And have that first love emotion inside, because we all need that passion, and you folks are doing that for me.
That's awesome. Thank you very much. I mean, look, when you have a vision like that's the first point. How do you want to do your dentistry, and then once you have a vision of how you want to do it, now everything else is just figuring out how you channel to that particular point. And I think that James, I know you definitely much better than Todd, because I've always seen you at the ACD conferences, and that's been a great journey for me in establishing what I want to do for my patients, and I would challenge any CEREC dentist to get out there and start working on that ACD curriculum, because if you really believe in CEREC, that you can make life like teeth, and we need more CEREC dentists to do that challenge and get accredited, because I totally think that with the technology and the materials and you have everything we need at this particular point to do it.
You know what's amazing about that organization, because that's pretty much set the sail for my career. I love the camaraderie there and the energy we get there. And over the last, I'd say 6 years, I always go to the lab events. Most of the programs there now are all off of digital platforms. Matt Roberts, Lee Culp, some of the other people. And it just inspires me. And I know you love surface texture. I know we've had several little notes that way. And I have this passion for surface texture. And
you just got like 50 hearts when you said I love surface texture. So I think there's other people out there that are weird like you.
But we are, Todd, you got to come to, I think it's in Colorado next year, isn't it?
That would be great. I'm not sure where it's at, actually, but that's definitely a great, easy location for everybody to get to.
But I did miss the one this year. In fact, I was speaking this year on, of all things, the aesthetic side of zirconia of all things and surface texturing. But I love teaching there. It's always an honor to be there. But more importantly, I learned so much there from people. But the energy, I'm pumping the AACD right now. In fact, at every one of my classes, you don't have to be looking at aesthetic dentistry to appreciate that, because they're about implants, they're about occlusion. It's just a complete platform that raises the bar. That organization, in my opinion, is raising the bar for me and everything I've seen in dentistry. Sorry, Todd, I'm you didn't know I was going to go here, but will you come with me next time?
Let me think about that.
I think
but now's the time for a commitment.
That question's for you.
And get the epic ladies there, and then if we could get that
If
organization,
the ladies go, I'll go. How about that?
Yeah,
if we can get a commitment of them.
Because
you guys need to come.
Do you know how many people are Syracusers there? It's amazing. In fact, last year, one of my friends who got the accreditation, I think he did 3 of his cases on CEREC.
That's awesome.
Which is amazing. Yeah.
Oh, okay. No, I want to talk about it. Well, and there's no reason why we shouldn't, and so that's why
Okay, so I'll make a commitment.
Yeah, Todd.
All right.
I'll make a commitment. If we can have a CEREC or even a CAD/CAM, let's just call it chairside CAD/CAM contingency that is part of the AACD, I'll join. There's other politics from history that I have not joined, so I'll just leave it at that. And but if there's a group,
Todd, look in the camera. Look at my eyes right now.
I have seen your eyes. I have seen your eyes, buddy.
You know I care for you, and this would be good for you.
Tell me again. Tell me how good this would be for me.
It would be really good for you.
It would be good. Yeah. Hey, I've been working on that accreditation for a really long time. In fact, John Weston's probably like, really, Lynn? But, it's a great journey, and it's definitely made me a better provider. There's no question about it, So there's lots of other, educations out there other than the ACD that makes you a better provider. It's really nice to be doing dentistry in this day and age because everything is so accessible.
Lynn, let me read one comment that we got from Dennis and Debbie Hobson. Dr. Thomas is truly is an epic dentist. On a good day, she saves a smile. On a great day, she saves a life by practicing complete health dentistry. That's pretty impressive right there.
Yeah. Wow.
Yeah, powerful.
Absolutely.
That is great.
Thank you, Debbie.
Yeah. So, Lynn, do you have any last words for your big fan base out there? Because we got a lot of people watching this. We got a lot.
So this is my last words for my fan base. My fan base would be, think about this is a time to hit the reset button. And if there's something that you've been wanting to do, now is the time to do it, because it's like before, BC, before COVID, and now AC after COVID, it's going to change, and don't be afraid to do it. Don't let your fears overtake you, because, you have control to do anything you want. It's your business.
Wow.
Maybe, if it's not, but you're steering the ship. So make it happen for yourself. You can do it. Those are my parting words.
Man, those were great.
Those are, Lynn, I admire you as a colleague, I admire you as an educator, and I love you and your husband.
Well, thank you.
You guys are right.
Love you too, James.
Yeah.
Thanks to you guys for having me.
Yeah. So we will see you in November. Okay, Lynn?
Wait, Todd.
Okay.
Lynn and I are going to see you at the AACD next year.
Oh, I know. Yes. Right. Yes. Correct. But we'll see you in November first.
It's time for a commitment.
All right. Okay. Well, since I've got AACD accredited teeth in my own mouth that James did, I'll consider it. So we can talk more after the conversation. Thanks, guys. Thanks, Lynn, so much.
Thanks, Lynn.
You're welcome.
Oh, cool.
Have a good one.
Wow, awesome. Just these epic ladies keep impressing me. They're just really fun. I'm just so inspired by their passion and motivation. It doesn't even have to deal with digital dentistry. It's just their overall core beliefs. It's just awesome.
You know what I like about what they're doing is they have this movement, which I think is the movement in CAD/CAM dentistry associated with Dentsply Sirona today. And they're inclusive. They include everybody, and I think that's something to be said for all of us, is being inclusive, because the momentum happens because of community, and I really admire what they're doing.
Yeah, no, it's been great. James, you got any last words for our friends out there in cyberspace?
Well, thanks for all the love hearts today. And I know they were for Lynne, but we're kind of getting a little bit of that ourselves with Lynne being on today. And thank you for the energy. And we're not going to stop, even though you're up and running next week. You and I have been discussing the fact that we're going to keep this a long-term trend,
right?
And then we also have some great people coming on in the future. So
yeah. we've got some amazing guests, and we've had. I'm so thankful for the people that have joined us, and we're moving this train farther along. We're going to keep going. We've got some awesome announcements coming up, and so I want everyone to stay tuned. Yes, I am starting a little bit early, and I hope states like Texas can lead the way and get other states like your state to follow along. We need it. So it'll happen. We're the Cowboys. We'll get it done for you, brother.
We are. I'm becoming a cowboy. I want to be a cowboy, and I'm as I've mentioned, I'm getting the right shirts. I talked to my wife about that afterwards. I need the shirts with the pearl buttons.
Yes, and we're going to put some cowboy boots on you and do the stair shuffle with the epic ladies.
I'm just throwing a hint out there. If you happen to send one to me, I would definitely wear it in respect for you.
Measure your head. I need to know your head size. Thanks, my friend. All right, we will see everybody tomorrow. Who do we have tomorrow? We have 2 assistants tomorrow. One of them being Cindy Barbie, my assistant, and Julie Varney from Dental Assistants Rock. She's got a big following, and so we wanted to give a perspective of some of the team members tomorrow. And then on Thursday we have Michael Fisher, the dude of Ladies Week, and Marissa Ziderick. They've got a great practice in the Dallas area. Incredible.
I want to go visit. I want to visit them.
Yeah, they're awesome.
A lot from them.
Yeah, they've both been to both of our classes, and we just think the world of them. And so they've got a great story about how they opened their practice, this big, huge, beautiful practice, only to be shut down by this virus. So it's good to hear what they're saying. So, all right, everybody, thank you so much. And James, why don't you end it for us?
Thank you for watching. We love you guys. We want to build up hope and courage in this time, and I think Lynne really helped us with that today. At least it helped me. So stay safe, and we'll see you tomorrow.